Yeah.
Fasting is your superpower after menopause. That is the quickest way to get healthy, to shed the weight, to clear up your brain fog, and to get functioning. So really just own that as your lifestyle after menopause. If you aren't sure if you're menopausal, if you feel like maybe you're still making hormones, but you don't know because you had your uterus removed, but not your ovaries, or you had an ablation, or you have a hormonal IUD, something like that. Sometimes it's trial and error. I would say listen to your body first and foremost, and only go into a longer extended fast when you feel strong and energetic at the get-go.
Hey everyone, welcome back to the Reshape Your Health podcast. I'm your host, Dr. Morgan Nolte. I'm really excited to bring today's interview to you. It's a topic that we've covered before, but not in as much depth as we're going to go into today. It's all about women's health, specifically for sex hormones. And our guest is Dr. Tabatha Barber, and she's also known as the Gutsy Gynecologist. She is a triple board certified OBGYN physician who specializes in functional medicine as a primary way for treating women's health. Dr. Tabatha, thank you so much for joining us today. I hope it's kind of a masterclass overview for our listeners and our Zivli members all about hormones, because we talk a lot about insulin resistance, but I wanted to talk a lot more today about the estrogen and the progesterone and the testosterone and everything that goes into keeping us regular, and then perimenopause and menopause. So before we get into that, just thank you, first of all, for your story. It's a pretty incredible story if you want to start there and just kind of how you got into this, and for sharing your time with us today.
Oh, I'm so excited to be here because women really need to understand that all of our systems are interconnected. And when we have insulin resistance issues, we often have adrenal issues or thyroid issues and gut issues and sex hormone issues. Everything is interconnected and pinging off of each other. And, you know, I come from the world of conventional medicine where everything is practiced in a silo. You go to the endocrinologist for your thyroid problem. You go to the gastroenterologist for your irritable bowel, and you go to the gynecologist for your heavy periods. And none of these doctors are talking to each other about what is happening in your body. And I know I was not trained to even think about the other systems, really. I would just pawn that off. Oh, well, I'll send you to the GI. That's not my problem. And unfortunately, when we approach health in that way, we actually miss the big picture. You know, we aren't looking at all of the pieces that make that picture up. So I was practicing conventional medicine. You know, if you read my backstory, I was a teenage mom, high school dropout. Nobody expected me to do anything with my life, but I overcame and I became a physician, right? And here I am living this dream that I worked so hard to get to. And I was miserable. I was in practice about 10 years and I was extremely sleep deprived, falling asleep at my desk, not having time to sit down and eat lunch. I was doing deliveries during lunch in the middle of the night. And I was in so much pain. My back was killing me. My brain didn't work. My assistant had to remember the people I delivered the day before because I couldn't physically remember things. It was terrible. And it wasn't until I took a step back and thought, what is going on? This must be something that I am doing or, you know, not realizing, because I was just a hot mess, for lack of a better term. Like I was in survival mode. I was miserable. And so here I am, the doctor, trying to help other women feel better, and I don't even know how to make myself feel better. So now I realize this is pretty much the norm in conventional medicine. You know, the doctors are just as miserable and unhealthy as the patients, yet we look to them for guidance and help on how to be healthy. And unfortunately, conventional medicine is focused on disease and diagnoses. It's not on health and wellness and prevention. And the lack of disease does not equal health. Those are two completely separate worlds. So when I found the world of functional medicine, it was like the curtains lifted. I couldn't believe all the information that I didn't know. And one of the biggest ones was that my body is working, all my systems are working together to create, this effect, this life that I'm living. And here I was neglecting so many areas: my sleep, my poor diet, my gut health, my stress management, all of these things. And it was showing up as heavy periods. I I tell this story of, I was out to dinner with my girlfriends. Like, I finally was not on call one night. I got to have some alcohol. I got to just relax and have a good time. Yet I had started my period right before I left. I put in a tampon. I wasn't out for a half an hour before I felt this gush just go down my leg. And I had a huge fluffy white coat on. It's the middle of winter. I put my hand down and it is red. And I look at my girlfriends and they just bust out laughing like it's the most hilarious thing that a gynecologist is soaking through her clothes out at this, party. And I was mortified. And I realized, like, I am supposed to know what I'm doing here. Why am I not able to control my periods? And the problem was I couldn't handle birth control pills. They gave me headaches. I had all the typical side effects: weight gain, headaches, mood changes. I tried an IUD, and honestly, it made me have suicidal thoughts. I was so depressed. I actually had thoughts of jumping out of the window at my office one day. And this was about 4 weeks into having it. And it's got to come out. And so I tried a lower dose IUD, but that synthetic progestin in that IUD really affected my mood. So I went and I talked to my gynecologist and I said, let's have an ablation. Just burn the lining. Let's be done with it. Right. I thought that was going to be the answer to my prayers, because that's what I do every week on women, that's standard of care. And she said, well, you've had 2 C-sections. Let's do an ultrasound. I think that scar is kind of thin in that area. And it turned out that my uterus had healed really thinly, and it was dangerous to do an ablation because the thermal heat, we burn that lining. And if you don't have a nice, thick muscle part of your uterus, the myometrium, you can burn through into the bladder, the bowels, whatever's next to it. And so she just said, very nonchalant, it's no big deal. Like, if we get in there and we realize we can't do it, or there's a concern, we'll just do a laparoscopy. I'll put a camera in and we'll take care of things. And I thought, hold up, like, I'm not going down this path. I know what happens in surgery, it's scary. And she said, well, let's just do a hysterectomy. And that was a big timeout for me, because even though I felt comfortable offering it to patients, being on the other side, I saw it in a whole different way. And I realized that this approach of just removing organs because we're done with them or they're misbehaving, and just this nonchalant approach to just get rid of the symptom is not the right way to address things. And it's dangerous. Unfortunately, I've fixed a lot of complications from other surgeons and seen a lot over my years. And so I went on this journey and I found out how to fix my heavy periods without birth control and surgical interventions. And that was eye-opening, and it was so exciting because I thought, okay, I need to start doing this with my patients. As much as I love being a surgeon, I absolutely loved it. It's not the right thing to do the majority of the time. We jump to it because we're surgeons, and I want women to understand gynecologists, first and foremost, are surgeons. I spent 4 years in a surgical residency. I didn't spend 4 years studying the endocrine system and the hormone system. That is not what a gynecologist is. And so this was a whole new way of thinking for me. And that is why when women come to see me now, we figure out what is causing these heavy periods, these painful periods, endometriosis, fibroids, all of these GYN problems. They're not actually a GYN issue most of the time. They have root causes. And so I hope that we're going to talk about all of that, because if you address the root causes, you'll fix these hormone imbalances. And estrogen dominance is probably the most common hormone imbalance. It's where you just have too much estrogen compared to progesterone, and it shows up with it's a growth hormone. Estrogen grows things. It grows the lining in your uterus. It grows your breast tissue. It grows the fat on your hips. It thinks you're going to carry a pregnancy. That's the idea. And progesterone keeps estrogen in check. So progesterone keeps it from overgrowing. It stops it at some point. So if you have an estrogen dominance pattern, you're growing too much lining in your uterus, causing heavy periods. You're growing that endometrial tissue, increasing your risk of endometriosis. You're growing those fibroids. You're growing cysts in your breast, all of that. You're growing extra fat on your hips, and you're carrying extra weight. And so I would say estrogen dominance is the most common hormone imbalance for women in their 30s into their 40s, and sometimes even their 50s.
So why is that one the most common hormone imbalance?
Oh my goodness. There's 5 really important reasons why we see estrogen dominance. And number 1, I would say right now at this time in society is alcohol. We have learned how to consume so much alcohol that we never have before because we deserve it. We had a stressful day, or we're hanging out with our girlfriends and it's peer pressure. It's just what you do. It's become this bad habit that we just lean toward. And alcohol is like a multi-billion-dollar industry, and it's catering to women now. If you look at the stores, you'll see all the fancy drinks that are really geared toward women. They're pretty, they're cute, they taste, sweeter, and women are buying into this idea like it's okay to drink every night, or 4 nights a week. And unfortunately, our physiology wasn't created like that. Even if you don't want to have children, which I completely respect, your physiology was created to procreate, because we've advanced in society so quickly and women are the boss and they're doing all these amazing things. Our body hasn't caught up. Our body is still a cave woman, and our body still thinks we're going to carry a bunch of children and, that we're going to try and survive all these situations. And so alcohol has really, been this thing. It's like the new cigarette, we thought cigarettes were fine. If you watch old movies, you see doctors smoking in hospitals in the waiting room. And that's how it is with alcohol. But unfortunately, alcohol is like one of the most important risk factors for breast cancer. It really is that toxic. And this, it's because it gets metabolized into sugar. It affects our insulin levels. And sugar is toxic. It's very inflammatory. It inflames the whole body and angers our cells. And so you have that whole piece of it. But on top of that, alcohol actually causes us to not metabolize our estrogen properly. So normally the liver does all these different jobs of turning things off when we're done using them, breaking them down, helping our body get rid of them, turning them into a less toxic chemical. And it will always choose exogenous things before endogenous things, meaning it's going to break down alcohol and Benadryl and Tylenol and all these other things you're ingesting before your own hormones that you made in your body. So if you drink alcohol every night, even a glass with dinner, your body has to put estrogen somewhere else to metabolize the alcohol and then hopefully get to the estrogen. But if you keep drinking, it never gets to the estrogen. And so estrogen goes down this other metabolism pathway called 4-hydroxyestrone. And that causes a reaction that can damage our cells, damage the DNA, and cause cells to go rogue and create cancer. So you get this perfect storm of like, you're not metabolizing your estrogen, your cells are inflamed from all of the sugar, and they don't have time to turn around and get healthy. So if you don't do anything else, cut back on the alcohol a little bit, and women are shocked at, oh, I just lost 5 pounds. Wow, I am sleeping better just by getting rid of the alcohol. My fasting insulin went down, like so many benefits. And nobody's talking about this. I have patients with oncologists from their breast cancer, and their oncologist doesn't even bring it up. And it's heartbreaking to me. Mm-hmm. So that's a really important one. Another one is our gut health. So we have all these bacteria in our gut that are digesting our food, trying to help absorb the vitamins and minerals, right? And then we also have bad bacteria that are hanging out in low levels, and they're just waiting for that opportunity to take over, especially yeast. Yeast are like, yes, let me just overgrow. If you've ever taken an antibiotic, you probably got a yeast infection afterward, a vaginal yeast infection. That's really common for women. It's because those yeast are just waiting. And so if we feed the bad bacteria and the bad yeast, then things start to overgrow. One scenario is you get yeast overgrowth, and that yeast, when it eats the carbs and the sugar that you eat, it makes alcohol, and that alcohol causes fatty liver. So what's happening in your gut is affecting your liver. There's also an enzyme that gets made by these bacteria that causes you to cut the garbage tag off your estrogen that your liver just worked so hard to put on there to get rid of and send out of your body. Those enzymes are causing you to reabsorb those estrogens, contributing to estrogen dominance. And I see this all the time. I order stool tests on my patients, and they have this beta-glucuronidase enzyme that's really high. And that's going along with their estrogen dominance picture. So it actually does matter what's going on in your gut. And almost always, estrogen dominance is associated with irritable bowel syndrome with constipation. So these women are only having bowel movements a couple times a week or every third day. And so that's allowing all of this time for the body to reabsorb this estrogen that was supposed to be leaving the body. Mm-hmm. And other toxins are getting reabsorbed. So it's really important to get your gut health right. And sometimes it's more than just cleaning up your diet. Sometimes you actually actively have to kill off things like yeast and bad bacteria. So the other issue that happens is stress. So there's the other post-pandemic issue is we were all under a lot of stress, right? And I like to explain that stress is a hormone that in good amounts is really healthy, but in too much amounts, it's damaging and destructive to our body. And it's made in our adrenal glands. And our adrenals are like our backup ovaries. So all of our hormone organs are talking to our brain, and our brain is talking to our hormone organs, our pancreas, our ovaries, our thyroid, our adrenal glands. And these conversations that are happening are interconnected. So my brain not only talks directly to my thyroid, but my ovaries at the same time. So a common scenario is a woman who has heavy periods. It's because her thyroid has downregulated and it's not functioning as well. So when the adrenal glands are working overtime because you're stressed and you're making too much cortisol, your brain's going to say to your ovaries, we're in survival mode. It's not a good time to procreate. Let's not ovulate this month. We don't want to get pregnant because you're running from a bear, you're dealing with a crazy boss, you have a gut infection you're not healing, whatever the stressor is, or you're training for a marathon, then you don't ovulate, then you don't make progesterone, and then you get into this picture of estrogen dominance yet again. Or even worse, if this goes on long enough, you can get into premature menopause, premature ovarian insufficiency, where women aren't able to get pregnant because they're not making hardly any estrogen or progesterone. So it's really important to understand that what is happening with your adrenal glands is directly affecting your ovaries. And this is important, like I said, for fertility and then for menopause. So I think back to when I was a child, my mom never complained about menopause the way women do now. Most women really didn't back in those days because they weren't as stressed out. And it's not that, I mean, part of it is that we are doing so much more than our mothers and grandmothers and great grandmothers ever did. But our environment is also so toxic and theirs was not. So our body has those stressors. Those are external stressors. All the plastics in our environment, all the plastic in our food and our water, it's a stressor on our body. All the EMFs from all the electronics, the list goes on and on. We have thousands of chemicals that our great grandmother never had to try and detox from. And so our body's dealing with all these stressors and trying to manage it as best it can, but your ovaries are going to be the first to take the hit from that problem. So you want to figure out, how can I decrease my external environmental stressors? How can I decrease my internal stressors so that your cortisol pattern goes back to normal and your ovaries feel safe to function again? And so, like I was mentioning, my mom didn't have a lot of symptoms because her adrenals were working fine when she went into menopause. So when your ovaries are done, you're like, oh, it's time to be done. We've run out of eggs. We're no longer going to ovulate. Your adrenal glands actually take over and make the majority of your sex hormones after menopause. They take the DHEA that they make and they make testosterone and estrogen, and they keep providing you with enough hormones after menopause. So you might have, some hot flashes, night sweats, but then you kind of transition. It's not a big deal. But women nowadays, it's like this crazy roller coaster. And it used to start at 48 or 49. That's what I was taught in medical school. About 49, you'll start the perimenopausal transition. You'll have some hot flashes and then you'll be fine. Now we're seeing it 40, 35 years old. Women are just on these roller coasters of hormones imbalances. And it's because their adrenals cannot handle any of these changes. They are not in a healthy state to regulate those ovaries. So it's imperative. If you want hormone balance, you have to start with the adrenals. And I point to my back because they're above the kidneys in your back. And I see this all the time when women go on hormone replacement therapy. They go get their bioidenticals and they think life is going to be amazing. They lose 2 pounds and then they're stressed out again. And it's because you're not addressing the root cause of why your ovaries weren't working in the first place. It's almost never just straight, easy menopause. It's adrenal dysfunction. It's gut problems. It's liver that needs to be detoxed. It's your estrogen, your xenoestrogens, all these chemicals in your environment that need to be removed. All of these things need to be dealt with for you to have a beautiful transition. Or on the flip side, to be able to get pregnant. I mean, it's the same thing on the other end of the spectrum. It really all is. We want to, say that it's this and that. It's all the same thing. You have to get to the root cause and address those issues.
Well, I was thinking as you were talking, you mentioned liver health, you mentioned alcohol, you mentioned some xenoestrogens as causes of estrogen dominance. Any other major causes that you can think of? And stress, obviously.
The biggest one is the synthetic hormones that we take. I would say the majority of women, especially in this country, go on birth control at some point in their life. And I am not against birth control. Like I said, I was a teen mom. How did I get back into school and end up going to medical school? I was on birth control and didn't get pregnant again. If I had had a second baby, things might have been different, but I wouldn't have been on it so long had I known what I was signing up for. So that's what I want to really emphasize is informed consent. Know what you're signing up for when you start taking these pills every day, because they are not a placebo. They are not innocuous. They can cause a lot of problems. And we like to think that this gives us so much freedom and this is the answer to everything. But unfortunately, it's actually the cause of a lot of problems that women are struggling with. And the doctor either doesn't know that it's from the birth control, or doesn't have another option for that woman. And so they don't even go there, right? Like, we're not even going to talk about it because these are the tools in my toolbox as a gynecologist. I have a birth control pill, I have some IUDs, and I have surgeries. Like, that's it. And so we really need to start looking to other people for help with our GYN issues, because they really are just hormone imbalances that gynecologists, by and large, are not trained to deal with.
Yep. And I think that I'd like to elaborate on that, but just kind of interject a little story here. One of our Zivli members said in office hours this last week, she's like, it's funny how everything's like, talk with your physician before you do X, Y, or Z, and then your physician doesn't know anything about X, Y, or Z. And a doctor reached out to me recently, and he's, board certified internist, obesity specialist, and just now over the last couple of years getting into these lifestyle changes. He said, I'm tired of just prescribing medications and understanding that, well, when they stop that, the weight loss is going to stop and it's probably going to come back on. And I felt like I wasn't really making a difference. But he said, one of the biggest barriers that I have to doing what you're doing is time in the clinic, and knowledge. We were not trained in insulin resistance or metabolic dysfunction or lifestyle changes. And so I just wanted to kind of pinpoint that. You alluded to it, but look, we've been talking almost half an hour already. And how much time do you get with a client or a patient in traditional medicine? I think that's a huge barrier that people really fail to deeply understand. Unless you're one of us, you're on the inside of the system, you understand that if you're spending so much time with a patient, you're going to get reprimanded. You understand that much of this education is not reimbursed by insurance. And so is there anything else there that you wanted to elaborate on, like why this conversation is so important to bring directly to people instead of trusting them to get it through their physician?
Yeah, unfortunately, like I mentioned, physicians are just as exhausted as the patient. And we are working endlessly all day, and we're stuck in a broken system where we don't read outside of the 2 or 3 journals that are required to keep our continuing medical education. There's no time to watch daytime TV or even think about what's happening outside the world of conventional medicine. I didn't know anything about fasting and wellness. And so I had a patient ask me about adrenal fatigue. She said, I just read about this. Do you think this was real? I had no idea what she was talking about. Yet if you just go search on the internet, it's everywhere. But doctors, we are in this bubble. Like literally, we are shielded from the world of health and wellness. It is not part of our training. Let me just be honest. When I was in medical school and in residency, the drug reps brought us lunch 2 to 3 times a week and taught us about their drugs. And that's how we learned how to care for people. That was how we cared for them, is we learned the new drug and we tried it out to see if it worked. And that was how my training was driven, was by drug companies and insurance companies saying, you need a better diagnosis. You can't do that. You can't order this test. I had an endocrinologist recently tell my patient he has no idea how to order a fasting insulin. He doesn't know what that means. I said, it's literally just a blood insulin level when you've been fasting for 12 hours. It's super straightforward and simple. But that is the training. It's very sad. It's just broken. So don't even be mad at your doctor that they don't know. Mm-hmm. They're not trained. And unfortunately, the food industry is also part of that training of the medical system. They are very much in charge. If you go into hospitals, you will see Pizza Hut and Coke and Pepsi. They are running the show. They are making the decisions on what our patients are being fed, what our doctors are being fed. And it's some of the worst food in the country, you know. That's what I lived off during residency and while I was a physician. And so I don't know how else to explain it. It's just broken. It's run by the wrong people.
Yep. And I just think I wanted to just really bring that to light, because I think a lot of people have this inherent trust in their physician. And unfortunately, I think it's misplaced. And I think you mentioned something on another interview you did that I thought was really interesting. You said, we can't practice evidence-based medicine if there's no evidence behind it. And most of these studies are being funded by, big food, big pharma. And what outcomes do you think you're going to get? And I think that really plays into a conversation that I want to have a little bit later today on that study that came out, 20 some years ago about hormone replacement therapy and why so many people became afraid of it. So before we get there, though, let's tie a bow kind of a little bit on this estrogen dominance conversation. And something that's kind of coming to light as we're talking about this is I wanted to initially say, okay, let's talk about the reproductive years and then the perimenopause years and then the menopause years. And if you're really listening well, you understand that it's the same recurring lifestyle factors that's contributing to the symptoms in those reproductive years, in the perimenopause years, and then postmenopausal. It's all about lifestyle. So when I was, 14 or 15, I was getting really moody. And my volleyball coach said, why don't you go on birth control because you're super moody? And I was having, heavy periods and eating so much sugar. I mean, so much sugar that I had no idea what I was eating. And so I went on birth control until college. I was just on it because someone told me to go on it. I didn't need it. Right. I was just taking it. And my breasts were getting so big, and I was, freshman 10, whatever, freshman 15, I was starting to gain weight. And I was actually considering a breast reduction surgery. Mm-hmm. And I was like, I'm so uncomfortable when I'm running. I don't know what to do. And I was like, maybe it's the birth control. I don't need it. Why am I taking this pill every day? And so I stopped, and I immediately lost at least a cup size. And how many people are in the same boat of like taking birth control because someone told them to 10 years before, or however long it was before, and then they just keep taking it? And you mentioned that women are on this pill for decades, and there's other options. So let's talk about what are some of the other options, maybe besides birth control, or if they need birth control, what is the safest birth control, and what's the ideal duration of taking that the hormone that's maybe contributing to estrogen dominance?
Yeah, that's the key, is you want to use it for birth control. You don't want to use it for symptom masking. If you are having heavy periods, irregular periods, painful periods, mood swings, mood changes, acne, headaches, that is not a reason to take these synthetic hormones. Yet that is the answer. That's the answer for everything. And the crazy thing is that we just treat it like it's absolutely nothing for decades. And then as soon as you hit 50 years old, oh my gosh, you have to get off of that. It's going to cause cancer. It's very dangerous. You have to be off of that at 50. And it's like, common sense has gone completely out the window, because cancer comes from something recurring over and over for long periods of time, disrupting the system, causing chronic inflammation and dysregulation. Yet we think that this birth control pill that we take for 20 or 30 years has no long-term effects whatsoever. We disregard them. It causes blood clotting issues. You can get blood clots in your legs and in your lungs. It causes major mineral deficiencies, major B vitamin deficiencies. And if you don't get enough B vitamins, you're going to feel anxious. You're going to feel depressed. You're going to have real hard time metabolizing your estrogen in that liver process. You need B vitamins. They put the garbage tag on the estrogen for it to leave your body. So the birth control pill is, first of all, giving you too much synthetic estrogen, and then it's preventing you from absorbing B vitamins so that you metabolize that estrogen that you're taking every day. So it's driving this estrogen dominance picture. And even worse lately is a movement toward vegetarian and vegan lifestyle for young women. So they're already going to be depleted in B vitamins because it comes from animal products, animal proteins. And so it's really common for women in their 20s and 30s now to be living this vegan lifestyle on these birth control pills, and it's driving so many hormone imbalances. And now they try to go off, they can't get pregnant, they have endometriosis. It's just this snowball effect. It's very heartbreaking. So, like you said, you have to go back to the basics, the foundation. If you have a teenager with acne and mood swings, the pill is not the answer. Getting the sugar out of the diet, sleeping enough, getting the plastic out of the food, those are the answers. That is going to be what helps clean up all those symptoms and get rid of those symptoms.
But my doctor didn't know. My mom didn't know.
No.
And so I think it's so important to just bring this to the public awareness that, as you said, birth control is for birth control, not symptom management. And I would advocate too that there's other forms of birth control besides hormones. So my husband and I have done natural family planning our entire marriage. One of my best friends teaches the Marquette method, which is a little bit more nuanced. So you do test things regularly throughout your cycle to determine when you're ovulating. So if you're the type of person that wants to even take it like a step further in the natural route, there's other options too. And they've worked for us and they work for many families, but there's options. So there's options either way. So how about this? What if someone is taking that, the birth control until they're 50, and then the doctor's all like, oh my gosh, you can't do that. You poked some really good holes in that study. So what are some of the big holes with that study that kind of poo-pooed hormone replacement therapy due to an increased risk of cancer?
Oh my goodness. This has been a travesty for women the past 20 plus years. So when I was in undergrad, it was really common for women to just get hormone replacement therapy. Everybody got Premarin or Prempro, these synthetic versions of conjugated equine estrogen, which is made from horse urine, and different forms of synthetic progestins, norethindrone, norgestimate, things like that. And because we had a multitude of studies that said it was healthy for your heart to stay on estrogen after menopause. It was healthy for your bones. And so women were on these hormones. And then a study was done called the Women's Health Initiative. And it was, I don't remember what year it was started, maybe 99 or 2000, but it was stopped suddenly in 2001. And something got leaked to the press that says estrogen causes cancer. Study stopped, because it's so dangerous. Like, it was so dramatic and absolutely ridiculous. And every media source ran with it. And all the doctors panicked, like, oh my gosh, we're going to get in so much trouble for causing cancer. They literally just wouldn't give the prescriptions to women anymore. They absolutely just refused. Stop cold turkey, all these millions of women. It takes 20 years for us to really hear from the lead investigator that they had an agenda. They sought out to discredit hormone therapy from the get-go. They wanted to prove that it caused harm. They admitted this, I think, in 2018, finally. And the reality of it was that there was two parts of the study: estrogen alone, Premarin, estrogen plus progestin, Prem-Pro. The Prem-Pro had one extra case of breast cancer in like 8,000 women or some ridiculous number. And they used that to justify stopping this study and saying that there's a risk when it wasn't even statistically significant. If you understand mathematics at all, it was not something that should have halted that study. And someone leaked it to the press. And so here we have all of this misinformation, and people ran wild with it. So then they started pulling out information from older studies and extrapolating, meaning like they took a result and they tried to find another bad thing to come out of it when it wasn't real. And so none of it was statistically significant. It wasn't actually true or meaningful, yet we were pulling all these informations out. And that's what the general public was hearing. They were all very afraid. The doctors were afraid to be sued. And so the medical system just had to say, okay, hormones are dangerous. We're not going to do this. And it's been this mess that we've had to clean up for over 20 years now, because the reality of it is there have been multiple studies since then disproving all of the stuff that came from the WHI. And the WHI was a really poor study. There was some major flaws in it, okay? The average age for menopause is 51. The average age of the women in the study was 63. The majority of those women were smokers. They already had heart disease and they were obese. So this was not a healthy aged population in the transition of menopause. This was an unhealthy population of women who already had comorbid diseases and were without hormones for over 10 years. That was the average woman in this study. And so they had blood clots, they had strokes, they had colon cancer diagnoses. Of course they did. They were unhealthy older ladies. And yet we took that information and we extrapolated and said, well, then a 48-year-old healthy woman, she can't possibly be safe on hormones. We can't do that. And they made all these blanket statements saying it's unsafe, no one should have it. And unfortunately, the damage has been done. So we've seen a really big rise in osteoporosis because estrogen actually does help the bones. We've seen a huge rise in dementia. Alzheimer's is 2/3 more likely to happen in women and men because it turns out estrogen actually protects our brain. The heart disease rates just skyrocketed. Insulin and resistance and diabetes went through the roof. If you look at that data, it all correlates with, just taking women off their hormone replacement therapy abruptly. All those diseases just went skyrocketing. So it's very sad. And women are treated like guinea pigs. They absolutely are. And so the pendulum keeps swinging, and now we're realizing there is a happy medium in there somewhere. There is a way to do hormone replacement therapy, but you have to do it in a smart, safe manner.
Yeah, well, let's talk about that, because usually that discussion starts in perimenopause. But as we've alluded to, a lot of people have IUDs, or maybe they've had a hysterectomy, or they're on birth control, and they don't even know when their cycle is. So if someone's coming to you maybe in that situation, what advice do you give them on how do I even know if I'm in perimenopause and might benefit from some HRT?
So there's a few things that you have to figure out as an individual. Some women are able to tell when they ovulate. They feel different those few days. They get a thicker, clear, sticky cervical mucus discharge, or they get a little moody, emotional, low energy for a couple days before what would have been their period. But a lot of women don't ovulate. It depends on what you're on. They claim that IUDs with synthetic progestins don't interfere with your hormone production, but that's just not true. The majority of women, it actually prevents ovulation and downregulates your hormone production. So most women aren't having a regular cycle on IUDs, and on the birth control pill, you're having no production of your hormones. Like, you're taking hormones. That pill is you taking your hormones, and your brain says, oh, don't make any. We already got it. And so you're not making your own estrogen, progesterone, and testosterone. And this is seen all the time in women on birth control pills. They have no libido, no interest in their husband or having sex, because they're not making that testosterone, because the pill shuts down that production. So that's a perfect example of that. So in those scenarios, most women, you can't figure out where you are in your cycle, because there is no real cycle. You either go off of it and see what happens. Unfortunately, it's becoming more common that women don't get their periods back after they come off of these, because their body doesn't know how to make the hormones now. You've suppressed that production so long, your body's like, oh, we don't do that anymore. Or it comes back with a vengeance with all these hormone imbalances because of what's been going on. So for some women, if their partner's had a vasectomy, or they're not worried about birth control, they've had their tubes tied, they can try and come off. You know, you can't use the rhythm method until you have a real period, so that can take a minute. But for women in their 40s, a lot of times they've had permanent sterilization, either a tubal or a vasectomy. And so they are able to get off of these and see what their cycle does. And it just depends on what happens. And so if you don't have any more cycle, yeah, you're probably in premature menopause.
Yeah.
If your periods are irregular, then we have to figure out, we have to do some testing to see what kind of hormone imbalance is going on. Do you just need support to ovulate again? Because you want to just get back in that basic rhythm. Estrogen grows stuff, causes your brain to go, oh, it's safe to ovulate. Let's pop off the egg. The area in the ovary where the egg was released, called the corpus luteum, makes progesterone. Estrogen spikes again, those two rise up together, and then they fall. And when those levels drop right before your period, everything says, okay, we didn't get pregnant. You can release that lining in the uterus. There's no egg to implant and take care of. So release it, shed it, have the period, and then you start all over again. And so you got to figure out, like, am I doing that at all? Where's the misstep? You know, is it I make the estrogen, not the progesterone, or I make the progesterone, but I don't sustain it long enough? Did I not ovulate? And so it's a puzzle. You have to figure it out with a provider who understands this. And it's not most gynecologists.
No, I was going to say, do you use the Dutch test, or what kind of testing do you use to determine their estrogen and their progesterone throughout the cycle?
I do it a few different ways. So the number one factor is, are you having any sort of a cycle that we can try to capture testing on a certain day? If you don't have any period, or you're on synthetic hormones like a birth control pill, you're just going to grab a day and start from there and see what your estrogen and progesterone look like, what your testosterone looks like. If you think, maybe I'm ovulating, you could use an ovulation predictor kit and see if you get that LH surge. You could test your temperature in the morning before you get out of bed, see if you see that rise. That's a good starting point. If your periods are all over the place, then I know you're not ovulating. I know you're not having any kind of formed pattern in your hormone production. And so we'll just randomly start with whatever day and start from there. And it gets more nuanced as you go, but blood can tell you how much of that hormone you have made that day. It's a good snapshot, but it doesn't tell you what your body's doing with that hormone, or how you're metabolizing it or getting it out of your body. So I use blood mostly for monitoring or for initial assessment of trying to figure out where they're even at. The Dutch test, which stands for dried urine testing of comprehensive hormones, you pee on these little pieces of paper, you let them dry, you send them into the company. They will not only tell you how much hormone you produced, but what your body did with it. Did you send it to the liver to be deactivated, to get that garbage tag put on, to be removed from your body? Did you reabsorb it to try to make estriol, a different form of hormone? Did you send it down that 4-hydroxy pathway we talked about that can increase your risk of cancer? And so that test is really helpful because especially in an estrogen dominance pattern, you want to know what you're doing with all that hormone, right? And so that test can be super helpful, but it's not covered by insurance like a lot of blood work is. It's a cash test. It's a functional medicine test. It's a kit that gets sent to your house, and you need a trained provider who knows how to interpret it. It's very complex, complicated, but it can give you some amazing information. And you take that information, and based off of that, you can tweak what supplements that you're using, what vitamins you need. How do we support these processes in your body? What diet changes do we potentially need to do to shift these hormones into a different, a more balanced way? So there's saliva testing as well. Some providers prefer saliva testing. I don't use a lot of that for sex hormones. I typically tend to use that more for the adrenal glands, like your 24-hour cortisol pattern, which is absolutely imperative that you understand what your cortisol pattern is doing if you're trying to get control of your sex hormones. So I love doing the Dutch Plus because it gives you that full picture of your adrenals and your sex hormones together. And then we can figure out where to go from there.
Yeah. So I really hope people listening, if you're struggling with any of these, symptoms that we've been talking about, do not just accept birth control, an IUD, or surgery if you haven't first had these more nuanced tests and conversations and really talking about lifestyle changes. And I think people often overlook the importance of the alcohol. They overlook the importance of the sugar and the stress and the sleep. But we were on a family vacation recently, and some of my cousins asked me my opinion on weight loss medications. And I said, you can't, that's fine if you want to do that, but don't expect it to stay off if you stop. And you can't out diet, you can't out supplement an unhealthy lifestyle. So you can never circumvent your way around the importance of taking care of your nutrition, your exercise, your stress, and your sleep, and your environment, as you alluded to. So with that, I have a lot of questions about intermittent fasting when they don't really know what their cycle is. So can you talk about that? Like if someone has irregular cycles, or maybe they've had a hysterectomy and they don't bleed anymore, and they're wondering, well, when's the best time for me to fast throughout my cycle? How would you answer that question?
Yeah. So first of all, menopausal women have it the best. That's the easiest situation.
Yeah.
Fasting is your superpower after menopause. That is the quickest way to get healthy, to shed the weight, to clear up your brain fog, and to get functioning. So really just own that as your lifestyle after menopause. If you aren't sure if you're menopausal, if you feel like maybe you're still making hormones, but you don't know because you had your uterus removed, but not your ovaries, or you had an ablation, or you have a hormonal IUD, something like that. Sometimes it's trial and error. I would say listen to your body first and foremost, and only go into a longer extended fast when you feel strong and energetic at the get-go. We have a few times during our cycle where our energy is low, especially the few days before our period. You should kind of be tuned into that as a woman, that like, I just can't handle things the same way. I don't work out, or I don't even want to work out the same way. I can't tolerate my husband. Like, that is not a time to do an 18, 24-hour, 36-hour fast, because your body is doing other processes. It's diverting resources to try to handle something over here. So that is not the time to fast. The time to fast for most women is after they've had their period, kind of days 4, 5, and 6, the tail end of it, you feel good. You're like thinking of all these things you're going to do this month. And like, I'm going to go conquer my HIIT training, or I'm going to run a marathon. Like, we get all kind of grandiose ideas those days. Like, we really feel good. Like, I'm like, oh, I'm going to write this book and do that. And it only lasts for a week. And then we're kind of coming down off that high again, because our body's getting ready to ovulate. And so if you pay attention for a couple months, like, what is your body feeling every single day? Start tracking it, writing it down. You will probably see patterns, and everybody's so individualized, but generally we tend to be around a 28-day pattern. And so if you can see what patterns are for you, then you can start adding in the longer fasts. But I typically say, I only want you eating in an 8-hour window most days. Like,
Right.
you know, if you're eating 10 or 12 hours, you better be super fertile, have your blood sugar dialed in, be doing that for other reasons. But for the majority of women, our bodies need a break. Our pancreas needs a break from eating, because we actually expend energy when we eat. It actually requires energy to digest our food and break down our food and handle all of that. So you have to give your body a break. So at least the 8 hours, sometimes the 6, work on up to it. You know, I teach women that you have to break up with sugar. You have to get into some ketosis before you can just like go drop into a 24-hour fast. It just doesn't work like that. You'll get hangry. Your body forgets how to burn fat for fuel, because you're so used to burning sugar all the time. Like, this is, you know, our society now, we're sugar burners. And so it's a transition period, but you can totally optimize everything about being a woman if you know when you're doing it during the month. So stay away from ovulations, stay away from right before the period, focus on those energetic days when your estrogen is rising and doing really amazing. And you can Google like the menstrual cycle and just see a basic picture of those 2 rises of estrogen during the month, and get a good sense of like, oh, that's what's happening with me.
Yes. And I think those hormone hills, you know, we all see them, but we don't always attribute our symptoms to the hormone hills, but it's true.
Mm-hmm.
So with that, I think there's so many other questions that I could ask you today. But I wanted to just pinpoint there. You said like eating 8 hours a day. So if you're doing a 16-8 fast, that should be relatively safe throughout the cycle. Is that kind of your opinion on it?
Yeah, I think that you should have a healthy enough cell so that you don't have insulin resistance and you can manage your blood sugar. And a lot of women, especially over 45, should be able to squeeze it down to 6 hours a lot of the time. You should be able to drop breakfast off most of the time, because honestly, we are not as active as we were when we were younger. Let's just be honest. Unless you're training for a marathon, you do not need all of that intake of calories and everything else. So for most women that I see, I try to actually do a feast famine cycling where they're doing probably a shorter eating window, 5 or 6 days a week. And then they're, you know, maybe having a longer window or even shorter window, depending on their goals, and adjusting their carbohydrates, you know, because the majority of us women, we eat way too many carbohydrates. We just don't need all of that. It just causes inflammation. So focus on protein, focus on fiber, focus on healthy fats. Unfortunately, we were fed these lies for the past 20 years that fat causes fat, and it couldn't be further from the truth. Like, women are shocked to learn that cholesterol is the main ingredient in our sex hormones. And here we villainized cholesterol for decades. We made us scared to eat an egg, and it's absolutely necessary to make our hormones. So we just have to undo all of the lies and misinformation that we've been fed all these years.
Yeah, that's kind of, I think, step one sometimes is unlearning, before you
Yes.
can relearn. So I know we didn't get to everything that I wanted to today, but you are just a wealth of information. Can you let people know like where they can learn more about you? I'm also going to link up just a couple other podcast episodes that I love that you did, talking a little bit more in depth on like different types of hormone replacement therapy and your opinions on that, since we didn't have time to talk about that today. So where can people learn more about you?
Yeah, I try to hit on all of these topics in the Gutsy Gynecologist show. It's, a podcast you can listen to. We also have it on YouTube so you can watch. Sometimes we show graphs and all that good stuff. So that is the first place. And I'm on Facebook at Dr. Tabatha. I'm on Instagram at the Gutsy Gynecologist. And we do work one-on-one with patients who actually want to deal with root cause issues, do stool testing and Dutch testing and food sensitivity testing, and really figure out like, what are my roadblocks? What's preventing me from being the healthy woman that I know I can be? So I have a team that can help you with that at drtabatha.com.
Perfect. Thank you so much. I appreciate your time today.
Oh, you're so welcome.